Hello, hello, NCLEX Crusaders. How are you? Good afternoon. Thank you for joining our YouTube channel. Let me know if you can hear me. Let me know if you can see me. I'll be sharing a presentation soon. I just want to make sure that you are able to hear me. Thank you. Thank you. All right. Okay, looks like, yes, I'm live. All right, perfect. Perfect, perfect. All right, let me share the PowerPoint presentation with you. All right, let me know if you can see the PowerPoint presentation. All right, perfect. All right, welcome everyone to today's live. It is a pleasure to be back with you on our YouTube channel. We are celebrating this year our 100,000 subscribers on our YouTube channel. So thank you everyone that have decided to join our YouTube channel, follow our teachings. I love the comments that I am seeing all over social media, on YouTube, on TikTok, on Instagram. Thank you. Thank you very much. I want to welcome you to tonight's training. I am back live on YouTube in 2025. I have been a little bit busy handling our academy, but I will find the time to get back here with our YouTube audience to provide some quality teaching on NCLEX preparation. So who's excited? Who's excited for today's teachings? Let me know. Let me know where you're logging in from. Where are you joining YouTube from? If you're here from the US, if you're joining from another country, let me know because I want to know who is here joining today. Thank you. Thank you very much. All right, let's see. Let's give it some time for everybody to join and then we will begin. Nope, we just begin the training, so do not worry. You got here on time. I see people joining from Miami. Very good. Welcome, Miami. From the USA, from Canada, Columbus, Ohio. Welcome, Columbus, Ohio. Massachusetts. Kentucky. Trinidad and Tobago. Nice. See, my wife was at Trinidad and Tobago for many years, working as a nurse. All right. Okay, let's begin. So if you are studying to pass the NCLEX and you've been struggling finding how to answer these NCLEX style of questions, if you have found that when you see NCLEX style of questions, you struggle, you think that your content is not sufficient, you think that your ability to answer NCLEX questions is not sufficient, I welcome you to tonight's training because we will be talking about how to master critical thinking. This is very important. Many times people ask me, my students ask me, Professor, what is the key to passing the NCLEX? Because I read books, I have been with many reviews, I go to the NCLEX and I don't pass. Why? What is the key to master the NCLEX? The key to master the NCLEX is critical thinking. Knowledge is great, But if you don't develop the ability to apply that knowledge, that nursing knowledge, the chances of you passing the NCLEX is very low. So I want to teach you here on our YouTube channel. There are excellent trainings. You know many of the trainings that we've been giving here, the 7-day training on critical thinking, the pharmacology training. And I know that many of you have been watching those videos over and over. But I want to bring something fresh, something new in 2025. But you may be asking, I see many times students asking on the videos that are from a few years back, if those videos, if those teaching are still good for this NCLEX, for the next generation NCLEX. And the answer is yes, of course. The NCLEX hasn't changed. The NCLEX just added new style of questions, but still you need critical thinking. Still you need to answer prioritization strategy. Still you need to use prioritization strategies. So everything that is in this YouTube channel, it is good and up to date for your NCLEX preparation. Now, of course, there are some videos back in the days where I talk about the select-all-that-apply questions. Remember that before the next generation NCLEX, there was no point value on NCLEX questions. Now you get points for answering NCLEX questions correct, but you will still see the classical questions on the NCLEX. So if you're ready to join tonight's training, if you're ready to pass the next generation NCLEX and master critical thinking, I welcome you to today's YouTube Live. Welcome, everyone. So let's begin. Let's review some important topics. These are the objectives that I want to cover with you in this training. What are the pillars of success to pass the next generation NCLEX? What is the difference between content questions and critical thinking questions? What is the difference between a recall and recognition question and analysis and application style of questions? And of course, we will be practicing some questions in today's training. Do you want to practice questions today? Let me know. Let me know if you're ready to practice questions today. All right, awesome. All right, also, I will be doing collecting some information for you for a raffle. I want to give each of you the opportunity to have and join our free NCLEX training. Okay, so we're going to do a fast track course that's going to begin next Saturday, but I want to pick somebody that is going to be able to join our fast track course completely for free. So if you want to have that opportunity, at the end, I will be sharing a link that you can join. You're going to have to provide some information, and then I'm going to handpick somebody from that list to win our fast track course. So if you want to join our fast track course, I have some information for you. Let's begin. Pillars of success to pass the next generation NCLEX. The most important thing is that you need to understand the NCLEX. You need to understand the exam that you will be taking. And you may say, well, Professor, I know the NCLEX is an exam that I have to take to become a nurse. Yes, but what is the framework of the NCLEX? What does the NCLEX really is testing on you? What are the key points that you need to develop to pass this exam? What are the different style of questions that you can encounter on the NCLEX? This is important. This pillar is important to passing the NCLEX. So I want you to familiarize yourself with the structure of the NCLEX. If you go to the NCSBN website, you're going to be able to see what they call a test plan, the NCLEX test plan. I suggest each one of you find the test plan and read it so you can become familiarized with the NCLEX. You need to master content. You need to know key content concepts on the NCLEX. Now, I want to say this. I have repeated this over and over, but I need you to listen. The key is not just to memorize random information. The key is to have the ability to apply nursing content. That is the key. You need to develop the ability to apply the nursing knowledge that you have obtained with reading books, maybe practicing questions on Q banks, or even watching these videos here on YouTube. The content that you have learned, apply it to NCLEX question. That is important. Another key point is to develop your critical thinking and your clinical judgment. I see many nurses that are extremely good with nursing knowledge, with content. However, they lack the critical thinking part. And I will tell you this channel, NCLEX Crusade International channel, is about the only channel that I have seen in YouTube that really focuses on helping students develop critical thinking. That is my expertise. This is what I love. I love to do questions together with you, help you analyze, help you understand, help you to develop the ability to see keywords, the ability to see distractors. That is key to passing the NCLEX. And of course, teaching you strategies that you can develop to answer NCLEX style questions. Strategies are important. What strategies? Well, some of you know it. The assessment versus implementation strategy, Maslow's hierarchy of needs strategy, the SAR method strategy, and many, many other strategies that we teach within our academy. So, critical thinking along with strategies, prioritization strategy is key to passing the NCLEX. Also, you need to practice questions daily with a good Q bank, with a Q bank that offers quality questions, high difficulty style of questions. You don't want to use a question bank that offers you basic content only style of questions. You need to think. You need to understand why. So practice good questions so you can develop that critical thinking. All right. So here in our YouTube channel, we have many videos where we have practiced questions with you that you can use to develop that ability. But you need to get a Q bank and you need to practice questions. Okay. So talking about understanding the NCLEX and understanding the algorithm. So I want to let you know that when we talk about NCLEX, you need to understand that there are different style of questions. Well, what do you mean, Professor? What do you mean that there are different style of questions? Yes, there are different style of questions. There are questions that are easier. There are questions that are middle difficult, intermediate difficult, and there are questions that are very high. And the NCLEX is computer adaptive. What that means is that if you answer an NCLEX question correct, the computer is going to give you a harder question. If you answer that question correct, the computer will give you an even higher difficulty question. And at the same time, if you answer a question incorrectly, it will give you an easier question. Now, what determines the level of difficulty on the NCLEX question? That is going to be determined by something called the Bloom's taxonomy. So how do we put together Bloom's taxonomy and the NCLEX? Well, there are questions where basically the only thing you need to know is remember nursing content, basic values, or maybe basic medical knowledge. But there are questions that they are content, but you really need to understand that content to answer the question. But it really gets interesting, and this is where the passing line meets the questions that are application and analysis questions. Those are the most difficult questions you will see on the NCLEX, and those style of questions are the one that is going to determine if you're able to pass the NCLEX or not. I don't know if you've ever taken the NCLEX before and you've received the candidate report. The candidate's report, The performance report basically tells you on the different categories, and let's say physiological integrity, psychosocial integrity, management of care. It's going to tell you if you are near, below, or above the passing standard. Well, the questions that are above the passing standard are questions that are at the application and analysis questions. What this means is that if you don't develop the ability to answer analysis and application style of questions, you will not pass the NCLEX. This is important. You can be an expert in nursing content, but if you don't answer analysis and application style of questions correct, you will not pass the NCLEX. However, do not get discouraged. That is an ability that you can learn, you can practice, and you can perfect. All right? So let's see the difference. What is the difference between a recall and recognition style of question and an analysis and application style of question? Well, basically, a recall and recognition style of question is a question where you maybe have to recall normal blood pressure values, normal heart rate values, O2 saturation values, and basically you have to choose what is the answer that meets these normal standards. That is a basic recall and recognition style of question. Like, for example, choosing a medication from a list. Very basic. Most of the students answer those questions usually very easy. The analysis and application style questions, these are higher level of cognitive ability or cognitive skills. Analysis involves breaking down complex data, understanding nursing components, understanding or interpreting critical lab values in order to apply the nursing knowledge on an NCLEX question. You need to develop critical thinking, and that is the key, once again, to passing the NCLEX. The NCLEX focuses more on analysis and application questions rather than just basic recall and recognition questions. This is why if you practice with questions that are only at the recall and recognition level, you're not using a quality question bank. You need to practice questions that are content, yes, but you also need to practice questions that are analysis and application style of questions. Let's look at the difference. For example, and I want you to practice here with me. So you want to write in the comment section your answer. I will be reading this question and we'll be discussing it together. But I want you to comment in the comment section your answer. That way I can see this basic, easy question. How are you answering? All right? Are you ready? Are you ready? Let's do it. Let's do it. A 24-year-old client with a recent diagnosis of type 1 diabetes presents to the basically the medical center with symptoms of increased thirst, frequent urination, and unexplained weight loss. Blood tests reveal a high blood glucose level of 280. The doctor prescribes a regimen of insulin therapy to manage the client's blood glucose level. What is the intended effect of insulin therapy in this client with hyperglycemia? So, although this is a rather easy question, it is important to understand some keywords that are in this question. It says, what is the intended effect of insulin therapy? The question is not about side effect. The question is not about adverse effect. The question is about intended effect. In other words, why am I giving insulin to a patient with hyperglycemia? glycemia? What is your answer? To increase blood glucose level, to decrease blood glucose level, to regulate blood calcium level, or to stimulate protein synthesis? As I can see everybody answering on the chat, the answer is very easy. The reason why we give insulin to a patient with hyperglycemia is to help decrease blood glucose level. Very easy. Very easy. Now, do you expect to have a lot of questions like this on the NCLEX? No. This is basic content question. This is a recall and recognition, maybe understanding style of question. I see somebody commenting on the comment section about diabetes insipidus. Oh, be very careful. It is different. Diabetes mellitus and diabetes insipidus is completely different scenarios, different health problems. Okay, we will talk about that on a different occasion. I also see some of you selecting answer C, to regulate blood calcium level. The reason why we give insulin is not to regulate calcium levels, is to regulate blood glucose level. Remember that the pancreas releases insulin to help decrease blood glucose level when it's getting high. So you have to understand that. Now, let's go to a different style of questions. But before we get there, I want to train your brain. So let's warm up a little bit, okay? And I want you to help me do it. So let's warm up, and then I'll show you some interesting questions. So warm up. You're gonna encounter on the NCLEX priority questions where they put two patients, two clients that are very close to each other. Sometimes you're going to think, wow, I think my answer is between 1 and 2. What do I do now? And I want you to be honest with me. How many of you, when you are in between two answers, you choose the wrong one most of the time? Who does that? Who makes this mistake? You're in between two answers and you always pick the wrong answer. If you make that mistake, I am here to help you develop the ability to answer the correct answer when you are debating in between two answer choices. All right? All right. So, what is the priority? Number one, or A, you have a patient admitted 2 days ago with myocardial infarction complaining of chest pain that is relieved after 2 nitroglycerin tablets. Patient B, a patient was just admitted complaining of chest pain. Wow, what an interesting scenario, right? And this is just to warm up. The difference here is that patient A was admitted 2 days ago, while patient B was just admitted. This is a keyword. You need to develop the ability to identify these keywords. You need to become an NCLEX detective. So, just admitted, that is keyword. Patient A says that has chest pain, but is relieved after medication administration. In other words, patient A received treatment and patient B has not received any treatment. Lisa, can you bring me some water, please? Sure. So, patient A was admitted 2 days ago and is receiving treatment. Patient B was just admitted and has not received treatment. Who is the priority? Patient B is the priority. Why? Just admitted and no treatment yet. That is important. All right. I got to drink some water. Let's go to the next scenario. Two similar scenarios. Patient A is a pre-op patient scheduled for a renal transplant, complaining of no urinary output. Patient B, a patient 2 days post-renal transplant, complaining also of no urinary output. Now, remember, this is just to warm up. This is not an actual NCLEX question. It's just for you to see a comparison in scenarios and identify and learn the ability to see keywords. That's important. So who's the priority here? What is the priority? A pre-op patient scheduled for a renal transplant with no urinary output, that is expected. In other words, these signs and symptoms, the no urinary output is expected in a client that needs a renal transplant. That is expected. In patient number 2, a patient 2 days post-renal transplant that is complaining of no urinary output, that is not expected or unexpected. So in other words, a chronic expected condition, when I compare it with an acute unexpected condition, the priority will always be an acute condition with unexpected symptoms or complications. This is a keyword. This is a strategy that you can use in priority questions when they give you 4 patients. What patient you will see first? The patient that has an acute condition that is showing unstable vital signs, complications of that condition, instability, airway, breathing, compromise situation. That is going to be your priority. So the correct answer is B. All right. Third scenario. You have a patient with COPD and you have another patient with appendicitis. In this case, patient A is a patient with a history of COPD, now complaining of difficulty breathing and an oxygen saturation of 85%, versus patient B, a patient with an acute appendicitis. What is the priority? Do I give the priority to a patient with a chronic condition such as COPD and an oxygen saturation of 85%? Or do I give a priority to appendicitis? What is it? See, this may seem easy, but it's rather difficult. And this is just a practice scenario. This is just a little warm up. This is why I tell you that it's important to develop this ability. So what do you think? All right, I see some of you telling me patient B, some of you telling me patient A. So how do I prioritize this situation? Because both are critical, both are important, but I need to find out the most important. The most important patient is A. Why? Because this COPD, which is a chronic condition, now has a change in condition. And the change in condition is an oxygen saturation problem, which means that there is airway breathing compromise. Yes, appendicitis is very critical. I understand that. But it's not airway breathing compromise. And for the NCLEX, you need to understand Maslow's hierarchy of needs. Maslow's hierarchy of needs says that if a patient is unstable and has an airway, breathing, circulation compromise, that patient has the priority. So although COPD is chronic, now because it's presenting with difficulty breathing, means that there is an exacerbation process going on. And that exacerbation process has to do with airway breathing, and that is the priority over acute appendicitis. Now, of course, in the real world, it's not like you're going to be waiting a whole lot of time with a patient with an acute appendicitis. This patient needs to go to the operating room, yes, but you need to take care of the patient with airway breathing problem because that patient can die now. That is the priority. So if you're ready to see an actual question, if you want to review a full question, I want you to subscribe to our channel. Subscribe to our channel right now. If you're here and you haven't subscribed to our channel, do so because we're going to be doing some training and I don't want you to miss any of the training. And the other thing that I want you to do is like this video. That is going to help us tremendously. It's going to help us show YouTube that you guys really like this training, that this YouTube is important, and it shows the YouTube algorithm that they can use these videos and teaching and show it to the rest of the world. And the other thing, if you know any nurse that is preparing for the NCLEX, invite them to our YouTube channel so they can also learn. So go ahead, like and subscribe. Thank you. Thank you. So, interesting question here. Are there any scenarios where ABC is not the priority? Yes, there are scenarios where ABC is not the priority. Yes, there is, but it's not as easy as you think. You need to really understand the scenario. And also, remember, priority is going to determine, it's going to be determined by comparison. Priority is when I compare, when I compare A and B, what is the priority between them? Because priority changes depending on what am I comparing. For example, if I have pain and a circulation problem, well, circulation has priority over pain most of the time. But if I'm comparing circulation and breathing problem, well, breathing problem will have priority over circulation. But if we're comparing breathing or a patient with an airway obstruction, or airway has the priority. So it's going to really depend on how you compare the scenarios, okay? Or what answers they're giving you to compare, I should say. I'm sorry for the cough. I've been having this cough for the past few days that doesn't go away, but it will go away soon. All right, let's go to the interesting question. Now that you've liked and subscribed to our channel, it says, a nurse is assigned to multiple clients. Knowing the risk of adverse effects on a client taking morphine, which client would the nurse reassess as priority after administering IV morphine? So there are some keywords here that I will highlight for you, underline for you to help you a little bit. Okay? Risks of adverse effect. The medication is morphine. And the question is a priority. So out of these 4 patients, who will be my priority patient? This is a higher level thinking, above the passing level question, an analysis and application style question. See, this is not as easy as the insulin question, which was basic content. Here you need to apply knowledge. Here you need to use critical thinking. So what do you think is the answer? Can I make it bigger? Let me see. Maybe if I can do this, at least so you can see it a little bit bigger now. Just for the so you can see the question better. And then I'll go back to it. So I'll give you some time to think about it. All right. So I'm gonna make it smaller now so you can see me, because I need you to pay attention to the emphasis I make. So what is my priority? The keyword is adverse effect of morphine. So in order to answer this question, you need to understand the effects of morphine. So what is the problem with morphine? What is an adverse effect that is important with morphine? Well, you know that morphine can suppress the respiratory drive. Morphine can suppress the respiratory system. So we need to look for a patient that can develop a complication, a respiratory complication, which is the main problem in a patient taking morphine. Well, let's review. Patient number 1, a 68-year-old with with liver cirrhosis, reporting severe abdominal pain and nausea. 35-year-old with pneumonia, complaining of sharp left side pain on deep inspiration. A 50-year-old, 1 day post-operative hip replacement surgery, reporting moderate pain at the surgical site. And a 70-year-old with obstructive sleep apnea, reporting mild pain in the knee after arthroscopic surgery. So, which of these patients can develop adverse effect or have a higher risk of developing an adverse effect of morphine? And it's very interesting to pay attention first to the ages: 68, 35, 50, and 70. So I ask you a question. Which patients have a higher probability of adverse effects of medication? An adult or an elderly patient? So that is the first critical thinking question that I need you to think about. Which patient has a higher probability of developing an adverse effect? Obviously, elderly patients. So with that concept, 1 in 4 is in my target point. So far, 1 in 4, I really like them because elderly have a higher risk of an adverse effect. Okay, now let's look at the problems that these patients are manifesting and also the diagnosis that they have. If we look at the diagnosis, liver cirrhosis, pneumonia, post-op from hip replacement, and obstructive sleep apnea. Out of these diagnoses, which diagnoses have a higher risk of developing an adverse effect from morphine? Thinking respiratory adverse effect, which is the most important. Liver cirrhosis, pneumonia, post-op hip replacement, or obstructive sleep apnea. Definitely the two that are respiratory, you will have you will have it in your target point. 2 and 4. Now, we've seen that so far, patient 4 has 2 conditions that places that patient in a high risk of adverse effect. Number 4, because of the age, elderly, and number 4, because of the diagnosis of obstructive sleep apnea. It's not only sleep apnea, but it is the obstructive type. Very interesting. Very interesting. So I really like 4 a lot. Now, some of you responded to the question because of the level of pain. For example, some of you thought the answer was 1 because it says severe pain. Some of you eliminated answer 4 because it says mild pain. But the question is not about pain relief. The question is not about which patient will you give morphine first. No, that's not the question. The question is about risk of adverse effect. So it's a totally different question. The patient that have the higher risk of developing an adverse effect of morphine is the patient that have more risk factor. Patient 4, elderly, 1 factor. Patient 4, of diagnosis, obstructive sleep apnea. So there you go, 2 risk factors that are very important to monitor and to look for risks of adverse effects. So the correct answer is answer number 4. Okay? Did you understand? Does that make sense to you? Let me know if that makes sense to you. All right. Very good. Okay. Now, we're going to be live again to practice more questions together. What I want to finish up by giving you instructions about how to join our raffle to win our 3 days fast track course. We have developed a fast track course that is 3 days training, only 3 days, every Saturday from 9 a.m. to 4 p.m., where we're going to cover these topics: delegation, prioritization, case studies, and standalone questions. With these 3 days, if you pay attention, 8 hours each day, 8 hours the first Saturday, 8 hours the second Saturday, and 8 hours the third Saturday. We're going to be teaching you prioritization, delegation, how to answer case study NCLEX style of questions with NCLEX strategies, and how to answer the standalone questions on the NCLEX. It's going to be an excellent training for you. It begins next Saturday, but I want to give an opportunity to some of you to have access to this awesome 3-day training for free. So my advisor, which is my daughter, Cicielani Arado, this beautiful young lady here, she will be providing on the link section, on the comment section, the link to register for this awesome raffle. It is also in the description section of this video. Go in there, fill out the information, and I will be picking 1, maybe 2, maybe 3. I will pick, who knows? Let's see. We'll go one day at a time. But I will give access to some of you that I know that may not be able to afford this training to have free access. This course, the cost of this course is $297. That's the value of, not the value, the cost. The value is, I don't know, unlimited value. How much does it cost to pass the NCLEX? You know, that has a lot of value. So the cost of this course is $297 US for this 3-day training. But I'm going to give a few gifts to a few of you. So if my advisor can provide the link, maybe I can, let me see. Let me get it to you. Give me 1 second. All right, here it is. Okay, so I'm going to put it here on the chat. Okay, just click on that link. See if I can pin it also here so you can see it on the top. There you go. I pin it on the top on YouTube. And there you go. Everybody can join. And we'll be selecting a few winners. So I'm going to be sure my advisor reach out to each one of you just to help you in general, give you some help, some insight on NCLEX preparation. You're more than welcome to be here with us every time we're live. Please only sign up once. Don't do it 3 times because I'm going to delete all the duplicates. Don't do that. Don't cheat. Be honest. God is watching you. Okay? So only do it once. Don't do it more than once because I'll make sure I delete any duplications. Okay? And then we'll pick a few of you. Okay? Claire, maybe 2, maybe 3. I don't know. We'll see. Okay? So thank you very much. We're going to be here next Friday at the same time. We're going to give another training. We're going to be practicing some questions together and give you the opportunity to join. So you have all this week to join. Friday, next Friday, I will be selecting live the winners right here on this live. You're going to see who wins and who does not win. All right? So don't miss that live. Thank you. Share this information with other nurses. Do it so, please. There's a lot of people that are very lost when it comes to NCLEX preparation. Share the information with others. Like this video and subscribe to our channel. Okay? Well, thank you very much. Thank you for joining us. Even though the ones that don't have the opportunity to win the raffle, if you want to join our training, my advisor is going to be talking with each one of you, and you're more than welcome to join our fast track course. Okay? So join at the right time. I don't know where I'm going to be doing it again. Remember, I do get very, very busy, and I don't do these courses a whole lot of times during the year because we're very busy in our academy. Okay. Thank you for joining our YouTube channel. Thank you for watching this live. See you next Friday at 5 p.m. Eastern Standard Time. God bless you all. Bye-bye.